National food consumption surveys are important policy instruments that could monitor food consumption of a certain population. Usually deployed for multiple purposes, this type of survey usually collects comprehensive food information using dietary assessment methods, a process targeted at improving the health and well-being of citizens.
For the past 20 years, we do not know what people are eating, and we are not able to link that with their micronutrient status. So, this is an important survey to be able to link our diets to our nutrition outcomes.
The survey, which is expected to begin from February to June 2021, has already kicked off with preliminary activities to assess the micronutrient status and dietary intake of Nigerian women and children.
The survey is about capturing what women of reproductive age eat, the usual intake of that population, with children under the age of 5 and pregnant women and adolescents.
Right now we are doing the pilot survey. We did the line listing where the targeted population were selected.
We will go at different times to capture what they eat the previous day.
This one, our kitchen scale. If you show us the what is where you eat, we go put down and we go tell us the weight.
And we'll be doing that 2 times to capture usual intakes, which we will be analyzing the data and coming up with results that will be used to reform policies, to work on programs around food and nutrition in Nigeria.
The government, IATA, and its partners are gearing up for a survey which will further better the health and well-being of Nigerians.
Nutrition is vital to our community, it is vital to our nation, and it is vital to Nigeria.
Welcome back. You're now watching the second segment of the lifestyle segment. We have with us Dr. Adeyinka Onabolu, the SA Food Security and Nutrition to the Minister of Agriculture and Rural Development. Also joining her, we have Mr. Dominic Elu, Deputy Director, Department of Family Health at the Ministry of Health. Thank you both for joining us on today's program.
Yeah, thank you. Morning.
Thank you.
You're most welcome. Good morning. So we're talking about the National Food Consumption and Micronutrient Survey, which is ongoing. Can you tell me more about this?
Okay, thank you. The National Food Consumption and Micronutrient Survey is a complex survey that brings together information on what people eat and also the micronutrient status. Because in Nigeria, we have very bad nutritional indices, and at the same time, coupled with that, we have that hidden part of it, which is the micronutrient deficiency. And those ones are very, very serious issues in Nigeria currently, because I'll give an example. 70% of women of childbearing age are anemic. And that may be because of what they eat, and it may also be because of illnesses or worms or other microorganisms that are causing issues. So this kind of survey tries to link all those problems with what we eat and also try to check the levels of micronutrients in the body so that the government will be able to come up with programs to address issues either from the food intake point of view or from other interventions like the health sector does, giving iron and folic acid. We may need to deworm people. So this survey is supposed to give us information for government to be able to do the necessary things.
So, Dr. Adeyinka, you've already touched on the benefits, some of the benefits for this, but what activities and what was done to put in place this survey? What activities were carried out to ensure that this survey?
Yeah, I don't know whether my colleague from IATA is on, because it is the IATA that is the lead implementing agency. And they have been in charge of all the activities done before.
I think we have Dr. Binyere Mukari, the Director Head Nutrition Division, Federal Ministry of Health, joining us virtually.
No, it's Dr. Mazia Dixon.
Okay, we have Dr. Busi Mazia Dixon, Senior Food Nutrition Scientist from IATA. Can you please tell us about the activities which were carried out to ensure this survey was conducted?
Good morning, all. Can you hear me?
Yes, Dr. Busi, we can hear you.
Okay. Good morning, all. Good morning, Nigerians. The activities we have done so far, which are related to this survey, is that we have gone around Nigeria actually collecting information on all the foods that are being consumed in the country, the way they are cooked. And then once we know how they are cooked, we then prepared a recipe which we went to the lab to prepare the foods so that we know the proportions of each. These foods, knowing the foods, the way how they are prepared, will help us in analyzing the data which we will collect on the types and amounts of food they have consumed. We have also gone ahead to select individuals from the different parts of the country to train them on how to collect this information from the participants, the types and amounts of foods which are consumed. We have also trained those who will be collecting for us the biological samples, that is the blood, the urine, and the fecal matter, so that we can look at the health status of the population, just like Dr. Adeyinka said, and also link this to the type of foods they are eating, and also what other causes they may be there for the micronutrient deficiencies and malnutrition we see in the country.
Dr. Mazia Dixon touched briefly on this, but can you speak to us about the type of people that will be participating in this survey, and you know, where has it started? What's the geolocation of these people? What do you intend to achieve? What are some objectives, you know, that we could see immediately and in the long run? Can you speak more about the plans and processes?
Well, most of these people are the data collectors who has been trained, like Busi have just finished saying, and they've been trained on. There are two sets of people training that are on field now: the biomarkers and the dietary intake. The biomarkers are the ones that will be taking the samples, while the dietary intake will carry out the data collection on the field. And they will be going to households that have been pre-selected. These households are the households that we have our targeted populations. The targeted populations are the under 5 children from 6 months to 59 months. Also, women of reproductive age, both pregnant and non-pregnant women, that is women within the age of 15 and 49 years, and also adolescent girls from 10 years to 14 years. These are the targeted group that will be interviewed, and their outcomes will help us to do the result we are looking for on this survey.
Okay. I would like to add that the survey population will be selected from all over the country. Okay. We are working with the National Population Commission and the National Bureau of Statistics as our main partners for listing. Mr. Elue mentioned that it's households, but the unit of assessment is going to be the individual. He has mentioned the group, and we have EAs, like the country has been stratified according to the geopolitical zones, and we have 65 EAs selected already by the National Population Commission. So we have participants all over the country. There is no state where our enumerators will not be. Okay. So that's just the addition.
Okay, and have you started?
Yeah, the work started this week, like Dr. Busi Mazia Dixon mentioned. Okay. We started with a lot of pre-survey activities. Now we have trained the field interviewers and also the biomarker people. So now we have the team on the field doing the mobilization and sensitization across the country. And after them, and almost in tandem, the people that will do the household listing, because they will go to the communities, sensitize, and then the households in each of the EAs will be listed, and it is only the target population, because when the listing is done, they list every member of the household. So it's only people that fall within women of reproductive age that Mr. Elue mentioned. They will now be selected randomly, and those are the ones that the enumerators and the biomarker people will work with.
So for our viewers at home who, because there's a lot to speak on this topic, for our viewers at home who want to know more about this survey and maybe want to play a part, who can they contact? Where can they get some more information from concerning all of this?
Thank you. Okay, we didn't get to talk about this. The survey is being planned and implemented by 3 ministries. Ministry of Finance, Budget and National Planning, Ministry of Health, Federal Ministry of Health, Federal Ministry of Agriculture and Rural Development. So people can contact the nutrition division of any of these ministries, and they can also contact IATA.
It's an absolutely laudable initiative. Most times as journalists, we find it difficult to access data, raw data. So I think it's absolutely brilliant that the 3 ministries have come together to collaborate on such a survey that would be able to prepare, statistics to us, to be able to plan as a country, and for us to also be able to report on these pertinent issues that not only affect women, adolescents, but all Nigerians in the wider scope of things. So thank you, 3 of you, for your time. We look forward to having you on the program again to discuss this in more details, seeing that it's an ongoing initiative. Thank you again for coming on this program.
Thank you.
You're most welcome. We'll take a short break right now. When we return, the entertainment segment of the weekend show. Don't go anywhere.